Hawaii has the enviable reputation for being the healthiest state in the nation. Not all of Hawaii's people enjoy good health.
More and more research is showing us now that the social issues, what we call the social determinants of health, or some people call your zip code being more important than your genetic code, plays a major role in our overall health and wellness. The majority of the influence on our overall health and wellness has to do with our behaviors and our environment, where we live. Do we have walkable communities? Are they safe for walking? Do we have easy access to healthy food? Do we have a roof over our head? Do the people in our community have jobs? Do they have a higher education level? All of those things contribute much more to health and wellness than necessarily going to the doctor's office.
We are fortunate to live in Hawaii, and as you know, by many measures, Hawaii is the healthiest state in the country. But we know that there's so much more that we can do. We still have diseases that impact our community. We can always do a better job to get our community healthier.
Good health shouldn't only be for those who can afford it. It should be for those of all ages, from keiki to kapuna. Creating a health system to improve access to care and health outcomes for all of Hawaii's people must be a shared responsibility.
We're enacting the governor's vision for health by creating a culture of health throughout Hawaii. And creating a culture of health means that health and wellness is everyone's Kuleana. That means me, that means you, that means your family, that means your place of worship, it means your work site, it means the community.
State government agencies like the Department of Health and Department of Human Services are setting the pace by collaborating together in new ways to improve the health of Hawaii's people.
The focus really is to look at the Department of Human Services and the Department of Health and how we can bring the resources that each has to focus on the family.
To move the state forward, the Department of Health collaborated with other state agencies, community health centers, health plans, nonprofit organizations, and others to develop a strategic action plan to address the state's most pressing health challenges. Teen births carry high health risks for moms and their babies, particularly if substance use is involved. Access to quality health care, especially those in rural areas and on neighbor islands, creates health disparities in our state. The Department of Health's Strategic Action Plan addresses these issues. We want Hawaii to be a state that makes health a priority for everyone, no matter who we are and no matter where we may live. With everyone's support, we can create a culture of health throughout Hawaii. Watch for more upcoming videos on the priorities the Hawaii State Department of Health is working on to improve the health of Hawaii's people. You can view the written strategic plan on the Department of Health's website by clicking on the About DOH tab.